Father Benedict Ashley, Father Albert Morcheski. I have battled with them face to face more than once, and so I can testify very strongly that what Bishop Gracita has shared with us is quite true and accurate. So far as that conference at Dallas is concerned, where all of the bishops from all over, as he mentioned, go, I'm quite familiar with what they have been teaching the bishops about brain death and related topics, and actually Dr. Collins from Chicago misquoted Pius XII to all of the bishops, and so it's no wonder that they are where they are sometimes on some of these subjects. As a neonatologist, how did I get started in this subject of brain death? And it began with Joseph in 1975, who had flat brain waves and said to be brain dead. And it was suggested to stop treating him, but I knew that he was very much alive, did not accept what was written on his chart, consistent with cerebral death. He was not dead, he was alive. I continued to treat him. He did go home from the hospital. This is a photograph when he was about 7. When he attended school, he got good grades. He ran track, he played baseball. He's married now. This is a photograph with Joseph and his wife and 2 children. They have another child since that time. But because of Joseph, I started to study what was being written about brain death, and it took at least 2 years until I understood the language of brain death, and just hearing the word brain death, you hear death. And you know what death is. You know it from the death of a relative, or you know it from the death of your pet dog or cat, or the caterpillar when you played with as a child. But you know what death is. Well, when someone is dead, their body and their organs are destroyed, and they don't function, and they won't ever function again. So if you go from death and you hear brain death, that's what you think. Then you go back to how they make the observations for brain death, and you find out that what they observe is an absence of the functioning. But an absence of the functioning does not mean that the function is gone, much less that the organ, whether that be the brain or whatever it is, that the organ is destroyed or that the person is dead. So it's something that was done to us, and even linguistically, it isn't correct to take 2 nouns, brain and death, and put them together. If you're going to do that in the English language, you hyphenate them, but they didn't hyphenate them. Just so you know, anytime that I write the words brain death, I always put it in quotation marks to indicate that it's what somebody else says, because it's not true. There's nothing true about brain death. There's Dennis, his wife, Sandy. This is a friend that was over visiting with him that day, but you see, Dennis is in a wheelchair. Dennis was injured on a motorcycle accident and was said to be brain dead. Sandy worked at the hospital and read things that I would ask her to copy on the copying machine, and so she would ask me sometimes, "Dr. Byrne, may I keep one of these?" And I said yes. So Dennis was declared brain dead. The relatives came in and paraded and to say their goodbyes to him. And then they said to Sandy, because all along she was saying to treat him, and then they said to Sandy, "We want to do one more test just to prove that he's brain dead." she said, "You mean for 2 days you've been telling me he's brain dead? Now you want to do one more test to prove it? That's nonsense. Treat him." So you see, Dennis, after he is recovered, he shakes my hand, he talks to me. He still has some difficulty with walking, but he's very much alive. There's Brandon. Brandon's from this area, and you're familiar with the Jones family, Bernice Jones, that I worked together. And Brandon, 16 years old, had a head injury, and what happens in organ transplantation, it starts already at the scene of whatever happens, and so he was put in an ambulance and was breathing and moving, and such that they tried to intubate him. He resisted. They gave him Valium, a strong tranquilizer, and gave it again. And then they gave him fentanyl, a strong narcotic. They gave him atropine that makes his pupils dilate, and eventually they get him to the hospital, and they paralyze him to intubate him and put him in an intensive care unit. And in less than 4 hours after he was at the hospital, they declared him brain dead, and sent his mother and father and relatives home, and then he was there at the hospital alone all the way till the next day, and it wasn't until the next afternoon at 5 o'clock at night when they took his organs. And when they took his organs, again, they had to do things to settle him down as they cut on him, because he was still very much alive and dissected alive. And it's no wonder that parents get upset, concerned, because they realize that their child is dissected alive to get their organs. There's Bernice and Dan, who are here today, and their family. Now, there's a picture of two hands. One is this hand. The other hand is Jahi. Jahi McMath is now 14 years old, but she was 13 years old, went into the hospital in Oakland, California, had a tonsillectomy and had bleeding after the tonsillectomy, and then was declared brain dead. And they declared her brain dead so they could get her organs. Her mother said, "No, you can't take Jahi's organs." So then what they said, "Well, if you won't let us take their organs, we're going to stop treating her." And she said, "No, you can't stop treating her. She's my Jahi. She's alive. It's a normal thing for her mother to do." So she was on the television. I saw her, saw the mother on the television, and my son and I watched her together, and her mother, Jahi's mother, was pleading for somebody to help her. So I went to Oakland, California, to help her, and that was in December 2013. December the 12th, 2013, they issued a death certificate on Jahi. This picture was taken just about 2 weeks ago when I was with her in New Jersey. Why do I show you just her hands? I show you just her hands. You see the nail polish, and if you saw her, you would realize that her mother had lip gloss on her that day, much like teenagers. And I show the hands because when her mother showed both hands in some of the pictures, some of the people said, "Well, how do we know it's Jahi's hands?" Well, I can tell you this much. I can tell you how you know that's Jahi's hand, because this is my hand. And that's why we show the picture that way. So there is no doubt that that's Jahi's hand. Now, why don't we show Jahi's face? Her face is beautiful, but her mother asked not to do that because some people distort things, and so Jahi is very much alive. She lives with her mother and father and her sister, her aunt, and the like. And she needs special care, but she's getting that. Her mother asked her, Jahi, raise your leg, and she raises up her leg. She says, Jahi, give me a thumbs up, and her thumb comes up, not immediately, it takes a while for this, but thumb comes up. She said, now you can put her down. She puts it down, but that doesn't count. It doesn't count. They still say that she is dead because the law says so. And once you get that label put on you, you can't get it off. And of course, it's serious matter because it's declaring somebody who's alive, declaring them dead, serious matter, but there are consequences of that. Consequences. The consequence is on December the 13th, 2013, her health insurance stopped. So there's been no payment of any of her hospital bills since that time. And of course, she was in California. They refused to do tracheostomy and gastrostomy that she needed. She did get transferred to a hospital in New Jersey where they did the tracheostomy and the gastrostomy. And Jahi is very much alive, and her mother is a very good person, very good mother, continues to take care of Jahi. And when I go to see Jahi, it's like some of the other patients that I've seen. The life is oriented around helping Jahi to live. Now, the human person, incidentally, the human persons are the only thing that's new in creation. God created the heaven and the earth and sent everything in motion, and it's all in motion, and it reproduces and does things. But the only thing that's new is the person. The person is unique and unrepeatable. Life on earth, there's a soul-body unity. Boethius defined the person as individual substance of a nature rational. These things are related to God, our existence. We get our existence from God. We can know that we are alive on earth. We can see each other. We can look in the mirror. We're one. We have spatial limitation. There's internal metabolism. There's a relationship to the environment that's necessary. We are made in the image of God, and our nature is the likeness of God, and we're able to reason, and that reasoning we can do good and avoid evil, and that's where our conscience is, and that's where the right to privacy comes from. In the Declaration of Independence, there are inalienable rights to life, liberty, and the pursuit of happiness. Liberty is a special word. It comes from two Latin words put together, liberum and arbitrium. Liberum and arbitrium. Liberum means desires. Arbitrium is mastery. And in Latin, the English translations they're reversed from each other. So liberum, arbitrium, reverse them. It's mastery over desires. Mastery over desires is to do good and avoid evil. That's how we form our conscience, and that's where the right to privacy is. The right to privacy comes from the inalienable gift, the inalienable right, which is to liberty. It's different from freedom. Freedom is a different word. Liberty comes from God. Freedom comes from man. So that when the president goes out of office, he gives freedom to prisoners often. When we rent an apartment, we have the freedom to live in the apartment, to eat in the apartment, to entertain our friends in the apartments. But we can't raise chickens in the apartment because we don't have the freedom to do that. Could we get the freedom? Of course. The landlord, if he's foolish enough, would let us raise chickens. But it comes from man. So realize that there are two different words. You will hear people interchanging them. Do they really know the difference? I don't know. But they are different. Liberty comes from God. Freedom can be granted by man. The person is living, and we can know about the living person from medical science, from biology, and just common sense will tell us that just common sense tells us that Jahi is alive. The person is living from true conception until true death. Conception used to be enough, and death used to be enough, because those words had meaning, but we have to put the words true in front of them because they get distorted. They both get distorted, but remember, the person is alive from true conception until true death. Now, the life is in every cell, tissue, organ, and system. Now, why do we divide it up like this? The basic unit of biology is the cell, and groups of cells go together to make up tissues. Cells and tissues make up organs, and then we divide them up into systems, which are functional systems, systems of function. In the human body, there are 11 systems. There are 3 major vital systems. They're all vital, but there are 3 major vital systems: the circulatory system, the respiratory system, and the brain, or the central nervous system. There's an interdependence of organs and systems to maintain the soul-body unity, to maintain life on earth. It's a unity of the body, but it's a unity of the soul and the body. And when the soul is there, the life is there. When the life is there, the soul is there. There's no one organ or system that controls all other organs and systems. The life on earth is a continuum from conception. There are important events in life, being born. Eventually, life on earth ends, and true death is applied to that. And when for a living body to become a dead body, it must go through true death. Actually, when I made this slide more than a year or two ago, I would tell you many years ago, but I don't know, that might get you thinking about things. But when I made this many years ago, I had on that slide the word dying. And then I read some things that St. Augustine wrote in The City of God. And he pointed out that in the Latin language, there is no word for dying, and clearly taught that a person is living until dead, and there's nothing in between. And it's like being pregnant. You're either pregnant or you're not pregnant. Being alive or you're not. You're dead. There's nothing in between. Now, loosely, the language of dying is around, but I try not to use it. I would say that it seems that someone will die soon, or it looks like death is close. But always those persons who are said to be dying, they're always living. Even if you insist on using dying, they're living in a dying condition, but they're always alive. It's clearly different. To live on earth, we have to have blood. The blood is very important, and the blood has to have circulation. Also, there has to be respiration. Respiration is oxygen in and carbon dioxide out. There has to be water. There has to be food. We have to have the proper temperature of our body and the environment. has to be exits for urine and stool. And there's hundreds and thousands of reactions that we in medicine know about, but there's hundreds and thousands that we don't know about that are going on all the time, and they're all necessary. Simple little things are necessary. How about breathing? The way that we breathe is the brain sends a signal to the muscles of our chest and the diaphragm to pull the air in. And we use the term ventilation. Ventilation is inhale air with oxygen. It's exhale carbon dioxide into the air. Ventilation and respiration are different. Respiration is the exchange of oxygen in and carbon dioxide out. When we breathe in, our muscles contract to make us breathe in, and then to breathe out, it's the energy that's stored in the muscles and in the lungs that cause contraction for the air to go out. It's just fascinating how this occurs. So the active part of breathing is to take a breath in, and then the energy is stored. I never really thought too much about a rubber band, but when the rubber band lays there on the table, it's not doing anything. And when we stretch it, then the energy is stored in the rubber band, so it will contract, and when we let it go. That's the way that breathing is. The only thing we do, the only thing that happens is to take a breath in. The breath goes out because of the elastic properties. That's true in you and me right now, and it's also true in Jahi. And it's been true all the time in Jahi. The Jahi is on a ventilator. The ventilator pushes the air into Jahi, and then her body stores the energy to push it out. And it's true in everybody who's on a ventilator. If the ventilator is working, the person is alive, because the ventilator won't work on a cadaver. Even if you put enough pressure on to push something in, and even if there was some stored energy for a bit, quickly at a few cycles and it would be gone. And the term is ventilator, not respirator, because the only thing the machine does is to move air. It does nothing to respirate. So a person who's on a ventilator is always alive, and if it's effective, that's not a cadaver. The circulation is important. The heart's a fascinating organ. It's not simply a pump. It has its own nervous system. It's just fascinating how the heart works. The beating of the heart is intrinsic to the heart. And I was going to look here, and I might find it. If I do, okay. If I don't, it's okay too. But the beating of the heart is intrinsic to the heart, and the nervous system that's in there makes it beat, and then, you know what? The nervous system makes it stop beating too, makes it stop and rest so that the heart can fill with blood again and beat again. It's all built into the heart. The brain does nothing to make the heart beat. It does nothing. And the beating of the heart is intrinsic to the heart, does not need the brain. If you have any difficulty believing that, realize that every time they do a heart transplant, they completely dissect all of the nerves and all of the connections that might have anything to do with the brain, and they put it in somebody else, and it starts to beat in somebody else because it has its own nervous system that's built into it. The heart's a fascinating organ, and it pumps the blood to the lungs and then to the rest of the body also. There's interdependence of organs and systems in you and me and in Jahi. There's a mutually interacting of liver, kidneys, heart, lungs, thyroid, adrenals, intestines, bone, and skin, and all of these things are going on in us all the time, and we're not thinking about them. They're going on in somebody who's declared brain dead also. In the heart, there's a factor the cardiac natriuretic factor that's in our heart, and it works on the kidneys. Some of you who may have had some trouble with heart failure might know that we measure this now. It's in the heart. It affects our kidneys, and it has to do with salt and water balance, and has to do with our blood pressure, and it's going on in everybody who's declared brain dead. And it's going on in you and me right now. We're not thinking about it. It's happening anyway. And somebody who's declared brain dead, they have a balance of energy. They maintain their temperature. Their temperature is often a little bit lower. They have healing. Somebody who's declared brain dead, they heal, where they cut on them to do things. Jahi had tracheostomy, gastrostomy. It all heals. They fight infection. They get fever. And when somebody is declared brain dead, to get their organs, what they do with them is they paralyze them so they don't move and squirm. But when they cut on them, the heart rate goes up and the blood pressure goes up. That could not happen in somebody who's dead. Those are all living persons. Now, each person is dead without circulation and without breathing quickly, without treatment, without oxygen. We're all dead in minutes. Without water, dead in 1 to 2 weeks. As Terry Schiavo took 13 days from the time they took away her food and water until she was dead. It would not take as long for us. It takes 13 days in Terry Schiavo because she was not active like we're moving around. And probably without water, we're dead in about a week. If we can survive that long. If you want to test it out on yourself, try not to drink until tomorrow and see how you feel. Without food, everyone is dead in 1 to 2 months. I had some communication indirect with people who were in concentration camps in World War II, and they suffered tremendously by being starved during that time. Dead is different from being alive. Dead, it's an absence of life. We can do all kinds of things to describe life, but dead is an absence of life. A cadaver, a corpse, it's a body without life. Without life is without a soul. The words that we use to describe the tissues, to describe the dead body, it's the remains. There's dissolution, destruction, disintegration, corruption, putrefaction, decay, and then rigor mortis. Rigor mortis is a manifestation of the destructive process in the muscles of somebody after they have been dead for a while. The destructive process, we can slow it down or delay it by cooling, by embalming, mummification, salting. After true death, and the Latin is mors vera, the church has always used these terms. They use Latin because it's the official language of the Catholic Church, but it can't be distorted. They had a term called mors vera, true death. And that was in contrast to mors apparens, apparent death. So after true death, what remains on earth is a dead body, a corpse, a cadaver. In Latin, it's spelled the same, but pronounced cadaver. And of course, the dead body is empty. The dead body is empty. Where did I get that word? I got that word from my grandchild at the funeral of my wife's mother, and my Shirley was explaining to Matthew about the grandma, the dead body in the coffin, and who that was in relation to herself, in relation to to my grandson. And Matthew said, "No matter what, Grandma, she's empty." And it's true. And what happens, see, I think she mentioned, but we have 12 children. When you are around children and you pay attention to them, they're very honest and they teach you things. Like Matthew taught me empty to describe a corpse. The cadaver, there's no breathing, no heartbeat, no pulse, no blood pressure, no circulation. The cadaver doesn't respond. There's no moving. They get cold. Their color's poor. They get stiff. Rigor mortis sets in. And the words that we use, the pathological words, are disintegration, destruction, decay, putrefaction in the cells, tissues, and organs. It's a lack of biology. It's pathology. These are different words, and we can use these to describe it. And then in death, there is destruction of cells and destruction of tissues and destruction of organs. And of course, from the doctor's point of view, is how much destruction does there have to be before we declare somebody dead? And we always, when we learned about it in medical school and the like, we learned that someone wasn't declared dead until there was no breathing, there was no heartbeat, no movement, no response, and we knew that we had to wait a sufficient period of time. That was never written down, but what that was waiting for was the time necessary for destruction to be manifest as the death of the person, for a manifestation that the soul has left. We don't know when the soul leaves, but we know that after the soul has left, we can then identify the remains of someone. They show you a television recording of Zach Dunlap, a 20-year-old young man who was declared brain. His death notice, Zach Dunlap's death notice was published. And the helicopter was landing to take his organs, but some people say it was miraculous that he's still alive, but what was miraculous is that he had a cousin in the intensive care unit who did another test and stopped them from taking his organs. And so you'll see this recording now. And you see, I've already told you about it, and you can see the black part in the CAT scan. In the actually, it's a technetium scan. You can see that this is his father talking about talking about the fact that they told him that he was brain dead. There's Zach. This is the recording from the newspaper. He passed away today at 11:10. His death notice was published, and there's a helicopter landing to take his organs, and there's Zach in the intensive care unit. Those are his cousins. Both worked in the intensive care unit, and there's Zach with tracheostomy. There's the nurse, and he's describing how it wasn't making any sense to him, and so he did one more test, one more test on his foot and got a response. Actually, when I showed this here in Vancouver area several years ago, one of the doctors came up and said, "Oh, that was just a Babinski reflex." And well, let me tell you, a corpse has never had a Babinski reflex. The scan that you're going to see is a technetium scan. See, there are these tests for evaluating circulation, and it will focus on it for the brain and the nervous system. But when they see no circulation, what it means is no evidence of circulation. It doesn't mean no circulation. So you see, in Zach, he had no evidence of circulation to his brain, but he had always a trickle of blood that kept his brain, the vitality of the brain was always there, never gone. And even though you'll see he had the clinical test, he had the scans, and the doctor who did them said, we even did the scans twice. Well, to go with Jahi, Jahi had the technetium scan, and which showed no evidence of circulation to her brain, but her recent MRIs show that she has very much brain in her head. Yes, she has some significant difficulties with her brain, but she has a large amount of brain in her head that's alive and functioning, although she has difficulty with manifesting that. But Jahi is very alive, as you'll see Zach Dunlap now.
Medevac to a hospital 50 miles away, Zach's prognosis couldn't have been worse.
His brain injuries were absolutely catastrophic.
With Zach unresponsive to any sensory stimulation, the hospital's director of trauma services ordered a comprehensive brain scan study. He showed Zach's parents what he saw.
He told us the dark areas will be the areas where there's no blood flow to the brain.
And that was the whole brain. That was the whole thing. It was just black.
Were the doctors giving you any sense of hope?
They'd already seen his brain did it.
Pam and Doug were told they could expect the harvesting of Zach's organs to get underway within the next 12 to 24 hours. With the clock winding down, the hospital notified authorities that Zach had died at 11:10 that morning, 36 hours after the accident. As a helicopter sent by the organ donation team was scheduled to land, friends and relatives gathered to say their goodbyes. That's when everything changed. Divine intervention, said his family, set in motion by Dan and Christy Coffin, Zach's cousins, who were also both nurses.
I started getting this different feeling in my gut, and I thought, he's not ready.
Dan wondered the same thing as he looked at the monitor to study Zach's vital signs.
Things were just looking better to me.
What did you do?
I grabbed his foot, and I pulled my pocket knife out, and I scraped from his heel up to his toes.
Dan and Christy said they got the shock of their lives.
He jerked his foot plumb out of my hand.
Was it possible? Was Zach still alive? Needing to challenge even his own skepticism, Dan said,
Well, let's try this. So I grabbed Zach's hand, and I stuck my fingernail underneath his fingernail. You know, that's a tender area. And Zach just threw his hand over here. And by now, this
So
kind
he physically moved that arm
his hand
over his
away
body.
from me, across his body.
And I kind of drew up inside myself, you know, and I'm like, oh my God.
I indeed verify that these were purposeful movements.
purposeful movement rather than a reflex twitch is a telltale sign of brain activity. Suddenly, 4 hours after Zach was declared brain dead, his room was bustling. Pam and Doug were out in the hall getting ready to head back in to spend their final hours with their son when they were stopped.
The lady that we've been talking to from the organ liaison came in and sat down with us, and she said, everything has stopped.
And what stopped was the taking of his organs. This is a slide that shows the blackness of his brain. With blackness, there's no circulation. You see the rest that's red is where there is circulation. This is the part where there's air. It is airways. This points out, again, no circulation. You can see where the eyes are and the nose to show that. And then, of course, Dr. Leo Mercer, Director of Trauma Service at a United Regional Healthcare System in Wichita Falls, Texas. This is not a fly-by-night outfit, and the transplant team was ready to take his organs. And you see there he is, completely recovered. Now, I'm going to show you a recording from a transplantation journal, and the title of this section is a multi-organ procurement from a deceased donor. Deceased comes from the Latin word decessus, which means departure from life. It means death. And you'll see them open the pericardium. The pericardium is the tissues that surround the heart. And you'll see the beating heart in a deceased donor declared brain dead.
Incision starting from the sternal notch to the pubis is made. The sternum is divided. and the thoracic organs are exposed. The self-retaining retractor can be used, and the pericardium is divided to expose the heart and the pericardial cavity. The falciform ligament is divided.
So you see, every transplant surgeon sees that when he cuts into the chest, and this is the beginning of taking the organs from someone who's had the declaration of brain death. But every transplant surgeon sees that pink tissue, he sees the beating heart, he knows that those donors are alive. Every transplant surgeon knows it, and they have some kind of proportionalism thought process, and the proportionalism is even more serious because it's proportionalism of one person to the proportionalism of another person. So it's even more complicated than the simple thought process of proportionalism. Where did brain death come from? It originated in 1967, the first heart transplant in South Africa. The second one was done 3 days later in Brooklyn, New York. They cut the beating heart out of a 3-day-old baby and transplanted it into an 18-day-old baby. The 3-day-old baby had mental retardation. The 18-day-old baby did not. At the end of their surgical procedures, both babies were dead. It was illegal and immoral, so what did they do? They set up a committee at Harvard, and the Harvard committee discarded the idea of no heartbeat, circulation, or respiration. They said somebody was in coma, and then they made it irreversible. Just so you know, a doctor can observe an absence of the functioning, a doctor can observe destruction, but a doctor cannot observe irreversibility. We can learn something about it, but it's just inferred. It's not a part of what we can do to observe irreversible. And they just made up brain death. And here's that baby, the baby that the second heart transplant, the baby that they took the heart from, you see, packed in ice. Awful. Go home and put your arm in ice and see what it feels like. They packed the whole baby in ice. The baby was actually born, I think, in Oregon, and then flown across the United States where they wanted to do that first heart transplant in the United States. Some things about the brain. This is a drawing of the brain. First of all, you see the skull, and the brain fills inside of the skull. You see this large blue part, that's the cortex. That's the largest part of the brain. And clinically, if somebody is unconscious, we can't evaluate the cortex. And likewise, the purple part down here is the cerebellum. That's the second largest part of the brain. The way that the doctor evaluates cerebellum is that we'll say, while you're standing, close your eyes, touch my finger, touch your nose. When somebody's unconscious, you can't do that. So clinically, there's no way in brain death to evaluate the cortex or the cerebellum clinically. Now, they talk about reflexes. Here's the brain stem where the reflexes are, and the reflexes are all through that part of the brain. And of course, it's connected to the spinal cord, but spinal reflexes are just discarded so far as brain death is concerned. So in brain death, what there is in brain death is somebody who is unconscious, and then it's said to be in a coma. A coma, by the way, is like comma. It's a pause. We used coma to describe somebody who's unconscious, but we expect them to recover. They're on a ventilator, but remember, the ventilator only works when someone is alive. And then they show that they can't breathe by the apnea test. And they take away the ventilator for up to 10 minutes. And then they look for brainstem reflexes, but they usually look for only maybe 6, maybe 5. And they don't consider the other 8 brainstem reflexes. EEG, they're not required to do it, but it's a recording of brain waves. It's not required. Then they do the scans. The scans, like that technetium scan was advertised as the gold standard, the ultimate standard. And Jahi had it. She's very much alive. Zach Dunlap had it very much alive. Why? Because the scan, like all tests, they're dependent on the amount of the stimulus to elicit a response, and then the sensitivity of the apparatus to observe or to record the response. And so when there is when the tests show an absence of circulation, it's an absence of the observation, not an absence of the circulation. And so it's an absence of the observation of circulation, but the vitality of the organ can still be there. And so these tests are false, and they're all set up to get the organs. What happens after the declaration of brain death, however they make it, and there are many different sets of criteria. It's the taking of the organs or the stopping of the ventilator in somebody who needs the ventilator that results in their true death. They can live for a long time. A patient of mine, TK, was 4 years old when he was declared brain dead, and I had the privilege of participating in his treatment and care. He lived 20 years after the declaration of brain death. Most of the time he was at home. I said to his mother one day, I said, "Renee, is it difficult to take care of," his name is Todd, "is it difficult to take care of Todd?" And she said, "Well, no, not that I got him at home." She said, because there's nobody trying to come along doing things to stop treating him. Incidentally, he never had a apnea test because his mother would never allow it to be done. So anyway, the Harvard criteria, it's not based on animal or patient data, and likewise, brain death is not based on any kind of science that would be adequate for any other purpose. There's no consensus in the criteria published in neurology. It's not evidence-based. That's a term that we use in medicine. And then, as recent as just last month, it was published substantial differences worldwide in the criteria for brain death. There's no agreement, no consensus. It's not evidence-based. They're clearly determined parameters commonly held by the international scientific community does not exist. There's no information given to the relatives or others involved. The patient declared brain dead cannot be truly dead. The apnea test may worsen the condition, including causing death. The clergy and the pastoral care persons are brainwashed into doing things to get permission to get the organs. The donors they primarily want are children, teenagers, and young adults. If someone is between 16 and 30 and they're unconscious, their life is in jeopardy. The goal and objective is to get their organs. And incidentally, you should know that more organs are taken from the poor people, the people who don't have insurance, and the organs are only given to the people who have insurance and wherewithal. And people should be paying attention to this. Who decides? Relatives, hospital administrators, coroner, and the laws are written now that a friend can give permission to take your organs. That's been added to the Uniform Anatomical Gift Act. The apnea test is done in every set of criteria. The ventilator is stopped up to 10 minutes. The patient is suffocated for 10 minutes. Even if they say, well, we give extra oxygen, ventilation is oxygen going in and carbon dioxide coming out. They stop the carbon dioxide coming out for up to 10 minutes. And what that does is increases it in the brain, and the brain gets acidotic, and it makes them swell, and it can only make them get worse. And so what you have to know is the patient must prove he can take in a breath, and that becomes a signal to get his beating heart out, and the patient can only get worse. And so the relatives have to know to say no, no, no to the apnea test. As soon as I hear about anybody, they contact me, I tell them, do not let them do the apnea test. So what happened? Bishop Cronin and I were involved with helping Bishop Cronin. Bishop Gracita and I were privileged to participate in taking care of Joseph Cronin in Texas. And as soon as I got involved, I said, don't let them do the apnea test. So he never had the apnea test, and of course, he continued to live. Bishop Cronin confirmed him. Bishop Cronin again, I said it. Bishop Gracita confirmed Joseph Cronin. Joseph was in Texas at that time. He too is in New Jersey. Incidentally, New Jersey is the only state that has a statute that says if the relatives do not accept brain death, that they do not have to accept it. New York has it in their rules and regulations, and there are some other things that go on in California, but New Jersey has the strongest protection against life in these matters. Incidentally, the donation is no longer by just brain death, and they call that DBD. It's now donation by cardiac death. Now, what is that? That's somebody who has a functioning brain, but they want to get their organs. And so what they have done is invented a way to take away their ventilator. They first get a do not resuscitate order. No one should get a do not resuscitate order. You have a do not resuscitate order, I'll absolutely assure you, you will get less treatment and care. It's not a good thing to do. So they get a do not resuscitate order, and then they turn off the ventilator until they're without a heartbeat strong enough to cause a pulse. So it doesn't mean that their heart stops, but they become pulseless. For how long? Sometimes 5 minutes, sometimes 2 minutes. In Denver, Colorado, it's reported in New England Journal of Medicine, 2 babies were without a pulse for 75 seconds, 1.25 minutes, and that was sufficient for the declaration of heart death. And then they proceeded and cut the beating hearts out of those babies and gave them to other babies. They distinguish organs from tissues. Organs need oxygen. The organs that are transplanted are heart, lungs, kidneys, liver, pancreas, intestine. They're all taken from living persons that are declared brain dead or declared cardiac dead, but they're not truly dead. All of those are living donors. The tissues you could get because they don't need so much oxygen. You can get them after there's no circulation. There's examples of that are skin. Incidentally, skin never gets transplanted, essentially never. The skin is taken and then used as burn dressing and the like. The bones, the corneas, God makes the corneas so it doesn't have blood vessels. If he would have put blood vessels in our corneas, it'd be like looking through our fingers if we had blood vessels. And he didn't do that. The cornea doesn't get oxygen from our circulation. It gets it from the environment through the tears. So the corneas can continue to have vitality after there's no circulation, vitality for several hours. Incidentally, they don't do many corneal transplants anymore because they take a little bit of cornea from the one who needs the corneal transplant and grow it in a petri dish, and it grows clear cornea, and then they put it back on, their own cornea. So the need for corneas is not like it used to be. The laws are all set up to get your organs. The Uniform Anatomical Gift Act, 1968, it was revised in 2006, Uniform Determination of Death Act. The HIPAA law the HIPAA law, you think that the HIPAA's law is there to protect your information. The first day in medical school, we had it drilled into our heads that we don't talk about patients in the elevator. We don't talk about them in the cafeteria. And on the nurses, they were even tougher. Doctors and nurses never gave out information. So you have to have the HIPAA law. Why do you have to have the HIPAA law? Go read it. There's 14 ways that the government can get your information without your permission and use it without your permission. And one of them is to get your organs. And does anybody know what this is? The PPACA? Anybody know what that is? Well, if I told you, it's commonly known as Obamacare. Another thing is they say Affordable Care Act. It's the Patient Protection Affordable Care Act. Well, who wouldn't be for patient protection? There's nothing in there to protect you. It's all there to do the cost-benefit analysis, which is to get you to have less treatment. The Uniform Determination of Death Act is cessation of function, but the part that makes it so weak, it's in accord with accepted medical standards, and that can be determined by one doctor. The Uniform Anatomical Gift Act, it's already passed in 47 states. It's already passed. It's presumed that everyone intends to be an organ donor. It's presumed that everyone has consented for all measures necessary to ensure suitability to living patients. Presumed consent is no consent. And incidentally, I think it's against the Article 13 of the Constitution. It's number 8 in the Constitution in Ohio. But what they have done is they've made slaves of us in terms of getting our organs. Nobody is informed, or very few people are informed. The transplanters know what they're doing. If you have an advance directive saying you don't want to be resuscitated, you will be. The Uniform Anatomical Gift Act, when it was written in 1968, said after death. The revised one says near death. You know what near death means? That means alive. And it goes on. That's a terrible law. Now, we do provide for you a medical opt-out card, and you should have gotten some of these, but we have more of them, and you have to carry it with you. And it says that I direct all medical treatments and care, including nutrition and hydration, be given to protect and preserve my life. Do not hasten death. Do not do an apnea test. Do not take any organ for transplantation or any other purpose. While that Uniform Anatomical Gift Act is a terrible law, but it has a provision in it saying that if you refuse to be an organ donor, you won't be an organ donor. It's written into the law. It's the one good thing about the law, but they give you no way to refuse. So we have given you a way to refuse, and some people have called it an opt-out card. Now, the modern culture of death, which is now a system of death. Culture is nice. Culture is what you cultivate. But the laws are set up to make it a system of death. And when does it start? The modern culture of death has a big impact. 1930, when artificial birth control was started. First heart transplant, second heart transplant. Look at this one. This is all 1967, 1968. The Uniform Anatomical Gift Act and the Euthanasia Society of America devised the first living will. You see where living will comes from? No one should have a living will. Living will has nothing to do with living. It all has to do with making you get less treatment and protecting doctors and nurses against liability. Kansas was the first state to get a brain death law. Persistent vegetative state, you hear that, PVS. PVS is just a made-up term. It has nothing to do with science, a made-up term, so it can predict that you will be dead within 6 months. It isn't so. People keep on living because it's just a made-up term, like brain death is a made-up term. And then you see where Roe v. Wade fits in here, 1973. But you see, that's all after all of this. And then Oregon, death with dignity. Washington, assisted suicide. And then here's hospice and palliative care. And then I come all the way down here to the PPACA, and now that you know what that is. Now, brain death is an immutable legal state despite signs of recovery. And if the diagnostic criteria for brain death are fulfilled at a certain time, the person is legally dead no matter whether those criteria become no longer fulfilled later on. So you see, it's written that way, and trying to get Jahi's death certificate reversed, it has been a struggle, and it hasn't been done so far. The diagnostic practice of brain death has established a devastating, poorly recognized conflict of interest, proportionalism from one person to another person. And who has the lobby? It's the person who is up and around like you and me. We have the ability to lobby, not the unconscious person, not the person who can't do anything to defend himself, not your children and grandchildren. And so why do we have this conference? It's to help you to understand, and you can go out, and we need you to go out and help to disseminate the truth about this. Incidentally, the truth is the life of the intellect, and good is the life of the will. And there's Jahi's hand and my hand, and with that, I'll stop, and I don't think I went too much over time. Incidentally, I'll tell you a couple more things. The recommended statute that we recommend, Father Quay and I devised this, it says, no one shall be declared dead unless the respiratory and circulatory systems and the entire brain have been destroyed. Such destruction shall be determined in accord with universally accepted standards. They should be the same in Oregon, in Ohio, in Canada, in Japan, in China. They should be the same. It's solidly based medically, ethically, and religiously, and unacceptable. And I put that in to remember something, but I already said it. A couple more things I have to tell you. Jahi's heart, in this person who's been declared brain dead, her heart has beat 60 million times since she's had a declaration of brain death. How nonsensical is the world in which we live. And then the other thing I have to remember to tell you, if you have questions, you have paper that's in your packet, write down the questions. If you want to direct it to one of us, that's okay. If not, it can be a general question, but write down your questions. We will do our best to answer your questions if you will write them down. The reason you have to write them down is two. One is so I can read them rather than hear them. And also it gives us a record of what your questions are, and that helps us speakers to know what we have to address the next time we get a chance to speak. So do that, and thank you very much for your attention.